Hi, I'm Virginia from Right Clinic, and here with me today is Nicole, who is a medical writer and medical editor. Thank you for being here today, Nicole.
Thanks so much for having me. Excited to be here.
Thank you. I'm really excited to learn more about you because I see you a lot on LinkedIn, and I'm sure other people see
Same.
you a lot on LinkedIn as well. So how did you get into medical writing and medical editing?
So let me maybe start by saying what it is that I do or like the different roles that I have.
Yeah.
I'm a medical writer at a mid-sized global CRO, and there I do um, predominantly regulatory medical writing, but also what's known as medcoms, so like scientific publications. But I do a bit of other communications as well. And then in my part-time, I volunteer as a content editor for Light Up Impact. It's a nonprofit organization that supports and empowers grassroots organizations in East Africa to become sustainable and to increase their visibility and their impact. So I feel like I'm doing really impactful work there along with our community. And then I also volunteer as a section editor for EMWA's, EMWA being the European Medical Writers Association's journal called Medical Writing. And I edit the digital communication section there. And how I got started, well, I feel like all medical writers have really interesting journeys or really interesting stories of how they got into medical writing. And certainly my career has been kind of not all over the place, but I've done a lot of really different things. I've worked as a pastry chef, I worked in external sales, I worked in clinical research, and of course, I have a PhD in biomedicine. So my journey into medical writing was, it was a journey. Um, I knew pretty early on, I would say during my PhD, that I wanted to work in clinical research or with clinical research. I didn't want to sit at the lab bench every day. And so I started exploring what I wanted to get into after my PhD pretty early on. And my PhD was quite unique in the sense that I was part of this Marie Curie Innovative Training Network. It was like a Horizon 2020 funded project. And it was a consortium of about 9 research institutions across Europe, and we were 11 what they called ESRs or early stage researchers. And they were not just training us to be good researchers in academia, but they were also preparing us for a career in industry, which I found really interesting and very unique. And so there was a huge focus on science communication as well. We worked with patient organizations where we hosted a crowdfunding campaign. We created a children's educational booklet. And so I got really excited about communicating science for the first time. Of course, I always really enjoyed like creating posters and writing abstracts and working on manuscripts, which I also felt that I was good at. And maybe that's also why I enjoyed it more. But for the first time, I really understood the impact that science communication has. Um, and the importance of it and creating accessible communication and information. Um, but I didn't really know what medical writing was or that scientists could transition into that as a career. I mean, outside of course, scientific publishing, which we all know really well. So it took me a while to discover it. And I actually can't remember exactly how I discovered it. I think it must have been through LinkedIn somehow because I became very active in my, search for finding out what is next after the PhD. And I must have stumbled across something, and it must have been through EMWA because the next step for me was to join EMWA and to reach out to members in that community and just, gauge what is this career really like? Is this something that I would enjoy? And once I figured that out, I pretty much just threw myself into it. I started writing a blog. I became very, involved with digital communication, like writing for websites, creating social media content, which was all really, really fun. And then about a month after I graduated, I was offered a position at a pharmacovigilance organization where I then started doing social media and a bunch of other things, which was very new to me, but also really, really exciting and different and challenging. And yeah, that's how I got into it. And now I love it. And I feel like this is my calling. And it's almost like, how did I never see this?
That is
But
so
it's
interesting. Thank you for sharing that. I just want to pick on a little moment that you said there, which is you started in social media. So, what kind of social media did you do, and how did that translate into working for a CRO?
so I did a digital marketing course through HubSpot, which kind of taught me the basics of how to go about, using social media for that purpose. And of course, I knew that I still wanted to work with the same type of content. And it wasn't that I was seeking a position in drug safety, which is a really difficult topic to communicate about. Um, but I really liked the format. I mean, I liked that I could practice all these things that I had learned for free using social media. And I slowly started building an audience. I really liked that it was so interactive, and that I could get, kind of immediate feedback on what I was putting out there. Um, and it was really fun. That was the biggest thing for me. I wanted to do something that I felt was impactful, but also that I really, really enjoyed. So that's how I started with the social media, and that's why I gravitated towards that position. And I also wanted something to be a little bit challenging. And I knew that because this was completely out of the sphere of research that it would be. So that's how I got there. Sorry, what was the other part of your question? How did
So
that
it was,
translate into the CRO?
yeah, yeah.
Well, as challenging as it was, eventually I did want to, as I originally intended, focus more on like medical writing in the traditional sense, I would say, like scientific publications, and also exploring a little bit the regulatory writing side, because I wanted to work with, I still wanted to apply the same analytical and critical thinking to, understanding and interpreting scientific data. And I wasn't really getting to do that in my position as where I focused predominantly on social media. So then I started looking for positions where I could do that. And someone reached out to me, my boss, Catherine, who I love. She had seen some of my work that I had published in MEW, Medical Writing, and was Journal. And yeah, she said, send me your CV. And I did. And we had a conversation. And I think she saw in me this extreme passion for medcoms. And yeah, I was happy to then make that transition into doing, more of that type of writing. Because ultimately that's what I wanted, on the very early stages of exploring my career options. And of course, like I wouldn't have done a PhD and all the rest if I wasn't really passionate about science and scientific discovery. So yeah, it was a very good fit. And at the CRO, of course, you get to do so many different things. Like I said, now I'm doing scientific publications, I'm doing regulatory writing, but I'm also doing bits and bobs of other things. And I've been helping out in other departments. So doing a bit of marketing communications, some internal communications, writing reports and things like that. So yeah, I like the variety. It keeps things interesting, and it keeps challenging you to do better and to develop as a writer.
Amazing. So I'm really excited to hear your journey because I think a lot of people want to go straight into a CRO and they kind of can't really see the many, many paths that you can take to get to that position. So it's really interesting that you went through that kind of journey, and thank you for sharing your story. And I suppose the next question is, what top tips would you give to someone who is trying to get into a CRO?
Well, not just a CRO. I say if you want to enter medcoms or be a medical writer, you should really just like I did, throw yourself into it. Like put yourself out there. It's really difficult to do because especially with social media, it's hard to be vulnerable, and you do like expose yourself a little bit by putting out content and then having people respond to it. It's like you want people to respond because you want them to like what you're putting out there, but at the same time you don't know if that's going to be positive or negative feedback. So that is a bit daunting, but it's important because it shows that you have the passion and the drive, that you're committed to whatever it is that you're doing on social media. And networking is, of course, a really big part of that. Um, like building your own little community and building really meaningful relationships where you can, yeah, collaborate and exchange knowledge. Um, so put yourself out there, like, network as best as you can. It's very challenging. I know it's very scary, um, but it's very fruitful. And the third thing I always say is start writing, like and start communicating. If that's what you're passionate about, what's stopping you? Like, there's so many ways that you can do it without, you know, there being any restrictions, like with social media, with people can create their own websites, people can make their own podcasts, YouTube videos. Like, if science communication or medcoms is something you want to do, just do it. And if anything, that'll just help you in your job search, because people will see what you've put out there. And if you've been doing it for a while, they might also be able to see that you've improved over time, which is really important. And I think we put too much focus on things like paying for workshops and courses and things like that, and depleting our budgets, when the best experience, of course, those things are also important, especially if you're moving from one industry into a completely different one. Um, but yeah, I feel like nothing better than actually just doing it, like the practical hands-on experience that you get from creating content. Um, so those would be my tips. And I've been handing those out to people who've approached me.
I love that. It's like your basket of goodies. Here's a tip for
Yeah.
you, a tip for you. That's great. So thank you for sharing those. I'm sure the audience will appreciate them. And I know sometimes, um, you might hear the same kind of advice from lots of different people, and that's because it works. So, you know, and I think sometimes people are searching for some kind of magic, and actually it's the taking action that's going to serve you in the long run. So it's actually going to make a difference if you take action, if you start writing, if you start building those relationships, just like you said. And community is so important, because you want to obviously feel like you can do everything yourself, but you have to learn from someone, and it's going to be better if you start learning from a collection of people, rather than just trying to do everything yourself. And even when you're at school, you're with other students, you kind of teach each other as well, even though you have the teacher. So it's about kind of embracing that experience. So thank you for sharing those tips. So what's next on the horizon for you? What are you looking forward to?
I'm looking forward to a bunch of different things. And I'd like to invite your audience to join me on those things. So firstly, as I said, I'm the section editor for digital communication at MU, but I'm also the guest editor for the June issue, which is on soft skills. So I invite everyone to keep an eye out for the issue when it's available. And of course, you can follow me if you want to yeah, be the first to see that. And I'm always, happy when people approach me because they want to publish something in digital communication. So if you have an interesting idea or something that you want to discuss or bring up in the medical writing community, it's a great way to do that. Just approach me on LinkedIn, or I don't know if you somehow can make my email available in the description box
Yeah, definitely.
to share that. And then I'd also like to draw some awareness to Light Up Impact. Of course, the work that we do is very important, and the work that our community does is very important. And it takes a lot of funding for us to be able to do that. As I said, we're a nonprofit organization, and we've recently launched our monthly giving program, and that's just a way for us to make sure that we also become sustainable and that our efforts are long lasting. So if it's possible, then I'd like you to share the link to that in your description box as well.
Yeah, I will.
And yeah, I'm always open to any opportunities to collaborate and to innovate. So if anybody would like to approach me for that, I'm happy to have a discussion.
Yeah, perfect. Thank you so much. So on a final note, where are you located at the moment? Because I think you had a bit of a location shift recently.
Yeah, I'm in New York. Since the last 2 months, I moved from Stockholm in Sweden to New York City now. I'm living in Hell's Kitchen, right in the center of New York City, Manhattan. Um, it's been, yeah, wild, but also very interesting, and I love it so far.
That's amazing. How long were you in Sweden before you moved to New York?
6 years.
Wow.
Yeah, I
Wow.
started a whole family there. um, and yeah, it was a big shift, but it was a good one. And yeah, it's nice. It's nice. And now I'm working fully remotely, that's like the first time ever that I'm doing that, with the exception of the during the pandemic, of course. But that's been a new experience too, and I'm finding myself kind of being okay and like using tips that people have shared with me that have been working remotely for a long time, to get through it and to connect with people more online and to go outside for walks and things like that. It really, really helps.
Amazing. So do you work remotely from home or do you go to offices and work from there sometimes?
From home, I would, yeah.
Yeah, I suppose that helps with having a family as well, because you mentioned that you started a family, so that really helps with the with raising the family. So really interesting. Do you enjoy it? Have you, do you kind of have, what are your kind of favorite highlights of being a medical writer slash editor?
It's difficult to pinpoint something, but I'd probably say, of course, the relationships that I build along the way, the people that I get to meet are so interesting, and they all have such unique and interesting opinions and perspectives. And then the research. I really love getting exposed to all this different kind of research across so many different therapeutic areas. Um, that's what I love. And it's nice that I get to do that on a day-to-day basis. And yeah, and I get to do it in a way that I really enjoy. So
Amazing. And do you kind of split your time 50-50 between writing and editing, or do you do more than one or the other?
I mean, if I look at it as a whole, I do quite a lot of editing in my free time. Um, so I would say probably more editing than writing these days, because I also do, of course, a lot of reviewing and editing in my medical writing job. Um, but yeah, so probably like 60-40 or something like that.
Amazing. Well, thank you so much for sharing everything that you've shared with us today. I'm sure that the audience will appreciate your journey and feel inspired. So, thank you so much for watching or listening, and I'm sure we'll invite Nicole again in future to tell us more about how things are going in New York because yeah, it's very different to go from Europe to America. So, we'll keep in touch.
Absolutely. Thanks so much for having me.
Thank you so much. All right, bye.
Bye.